Good evening. Welcome to the Board of Commissioners of Abington Township's preliminary budget meeting of November 10th, 2015. And at this time, I'd like to turn it over to our Township Manager, Michael Lefebvre, for an overview. Thank you.
Thank you, President Luker. Good evening, Commissioners. We have a relatively brief presentation tonight, possibly 8 or 9 slides to walk you through, and we wish we had better news at this time. First slide is basically to pick up where we left off at our last budget work session on October 15th. At that time, we had a funding deficit of $1,154,068. Kevin and I were optimistic at that time that we could make certain spending cuts and hopefully have some reduction in our projected health benefit costs to bring that number down to a more palatable level. The 1.154 deficit represents about a $50 tax increase for the average household. We were optimistic we could probably get that down to the range of $30 to $35, which we well aware will still be a problem, but certainly a little more palatable. Unfortunately, that hasn't proven to be the case. We want to walk you through some of the changes that were implemented. First step, we added the 10% of the 2014 year-end surplus, that $10,000, as an opening balance for 2016, which reduced the deficit by a corresponding amount of $69,416. And there were a number of additional cuts that we implemented. First was an additional fire inspector position for the fire department, approximately $54,000. There's a training overlap for the replacement of the township engineer at the end of 2016 of $18,400 that was deleted, and about $3,000 in miscellaneous costs in the engineering department. In the police department, we took the civil service exam out of the budget. You may recall, historically, that was always taken from contingency when needed, so we're going back to that method. And also, we removed $4,000 in additional training requests. Vehicle maintenance, we eliminated one vehicle because, quite honestly, it was duplicated budget. It was also included in the permanent improvement fund budget, so we eliminated that cost. And the last expense that we eliminated was an additional $30,000 in contracted services to support parks operation. As a result, we brought the deficit down to $940,129. And this is where we ran into problems. At the last meeting, we were very optimistic we could reduce our health cost. At that time, we already had our core costs for our core benefits along with dental and vision. We budgeted a 9% increase across the board for health benefit increases in 2016. Our actual core benefit costs for salary and clerical and per diem remain level, and that's a result of the change to a higher deductible plan for both groups of employees. If you recall, we moved the employees to a higher co-payment, which basically leveled out any projected increase. The police contract has yet to be resolved, so we included a full 5% increase, and the retirees, the same 5% increase. Those numbers represent substantial savings from the 9% that we had budgeted. Unfortunately, last week we got our prescription projections for next year. Our prescription benefits are self-funded. Historically, they've always been self-funded. We received our projected cost increase based on actual utilization this year, along with the funding, a trending increase for next year. The result was an 8.6% decrease for per diem, a 22.6% increase for retirees, a 63.8% increase for salary and clerical, and a 75.2% for police personnel. Through our wildest imaginations could have projected increases of this level. They're not attributable to any one reason. The police increase is basically tied to specialty drugs, not an employee, but some recipient of a benefit taking a specialty drug, a high-cost specialty drug. The per diem decrease, on the surface, looks like an improvement, but actually that's a result of 2 employees going off a high-cost specialty drug. Previously this year, our per diem group was our highest-cost group. They're now the lowest-cost group, replaced by salary and clerical and police, then retirees and per diem. The net result, because of the increase in prescriptions, instead of 9% covering our costs, we had to add an additional $201,732 to the budget. Now, we did offer additional incentive for people to opt out of our health benefits. Historically, we've offered a very, very low percentage, and we really didn't have a lot of employees take advantage of it. They may have a spouse employee with excellent benefits, but since the incentive really didn't do the job, a lot of employees didn't opt into it. We increased the incentive, and we did have additional employees take advantage of it. It resulted in $25,000 in saving. That could increase. We had a number of employees indicate an interest in opting out. They've yet to submit paperwork indicating they will do so. So potentially that number could go up a little bit higher, maybe as high as additional $70,000. That's yet to be determined. But the net increase is $176,732, which brings our deficit back to $1,116,861. Not as high as we were in October, but pretty close.
Michael, the prescription drug programs that you're bidding or that you're pricing out that have the increases, are those all contractual obligations, or are there flexibility in what we're providing?
Well, because we're self-insured, they're actually based on current utilization, what the employees currently are using. What we're looking at, in fact, at the meeting Thursday night, we're recommending that we change plan administrators. That one step that we think will improve our situation in the future. We're looking to contract directly with the pharmacy benefit manager, which is Express Script, that will give us some flexibility in the future. But the real issue here with prescriptions going forward is the specialty drugs, the high cost of specialty drugs. Currently, we have employees paying for a generic at $10 or a brand name at $20. There's no third-tier cost to the employee. So you could have a specialty drug costing $100,000. The employee paying $20 towards that benefit, the town should pick up the remainder of the cost. Most of the insurers are moving to a much higher copay for specialty drugs, a third tier. Next year, Blue Cross, for all their smaller plans, are recommending or implementing a 50% copay for specialty drugs up to $1,000 per prescription. Now, for a $100,000 specialty drug, the employee would be paying $1,000, the town should be paying $99,000. But at least the employee would pause to think about, do they really need to spend $1,000 for this drug, or could they opt into some other drug at a much lower cost? That's the only way you really can control these costs going forward, to be perfectly honest.
Michael, I'll start off with another question. Would this have happened irregardless or irrespective of what healthcare provider we were contracted with?
I believe so. We're also looking at the possibility of moving the prescription benefit to an insured product. The problem with that, we approached Divot to provide our core benefits, and they've asked for our utilization numbers. And quite honestly, Divot's administrative costs are higher than our current cost, and there is a cushion in their numbers to provide for unexpected expenditures. So I don't think that's going to result in the savings. So our options are somewhat limited, to be perfectly honest.
So that change in the specialty drug deductible, if we wanted to make that kind of change, that's all part of that has to be done through contract negotiations.
For most of our employees, it would have to be done through contract negotiations. Absolutely right.
Okay.
Any other questions from commissioners?
All right. So to close the gap of $1.1 million, for a millage increase, it would require almost a third of a mill, 0.329 millage, which as a percentage is 8.23% increase. For the average household assessed at $150,000, that would result in a $49 tax increase. The $49 would actually be broken down at $38 as a real estate tax increase and $11 towards our fire tax. Currently, the fire tax does not cover the fire department expenses, so we'd have to bring that in line with actual expenses. Understanding how unpalatable that is, and with the expectation somebody would suggest we take the deficit from fund balance, I just want to refresh your memory on the new fund balance policy. The previous policy required a minimum 7.5% of revenue be maintained without any maximum level. Last year, as part of the budget adoption, we moved to a new policy tied to actual expenditures, a minimum of 1 month expenditures up to a maximum of 3 month expenditures, with any excess over the 3 month expenditures being distributed to the Permanent Improvement Fund, our OPEB benefits, and 10% towards budget support for the following year. Now, looking at actual numbers for this year, the minimum fund balance is approximately $3.1 million. The maximum is $9.2 million. As the budget grows each year, those numbers will grow along with the budget. So with the numbers proposed this evening, in 2016, the minimum would be $3.2 million, a maximum of $9.4 million, approximately. If you were to take the $1.1 million deficit from the fund balance, the $9.2 million number, it would reduce that number to $8,144,834. In the short term, everything will be fine. We could take it out of fund balance, balance the budget, no tax increase, everyone's happy. The problem you have, it creates a dramatic problem for 2017. I just want to walk through a hypothetical situation for this year to illustrate the problem. Assuming we finish the year with a fund balance surplus of $1.2 million. I just pulled that number out of the air, basically to bring it in line with the deficit of $1.1 million, but it's certainly not an unreasonable number. We will finish with a surplus this year. We're very confident of that. We just don't know exactly what the number will be. We won't have that number until the spring after our books are audited. But a $1.2 million surplus is only 3.3% of our budget. It's not a huge variation. But if we actually finish this year with that money, $660,000 would go to a permanent improvement fund to help fund those obligations next year, or in 2017. $420,000 would go to our OPEB obligations, and $120,000 would go for opening balance in 2017. If you take the $1.1 million from fund balance, you automatically have a deficit of that amount going into 2017. In addition, you'd lose the $660,000 under this scenario and another $120,000 as an opening balance. You're creating a hole under this scenario of $1.9 million without looking at a penny increase in any of our expenditures. Our costs will go up next year. Historically, they go up. 76% of the budget is directly tied to personnel. You have contractual obligations. You know healthcare costs are going to go up. So the deficit in 2017 could be anywhere from $1.9 to $3 million. It's not unreasonable to forecast that. So if a $49 tax increase is not acceptable this year, can you envision what tax increase you'd be looking at in 2017 under this scenario? We tried to illustrate this on a graph by taking the $1.1 million out of fund balance and limiting it to that deduction in future years for a fund balance. The fund balance is the higher number, illustrated in red. Within 5 years, you'd be down to the minimum level of fund balance. At that point, you couldn't take any more and would just stay at the same amount. It actually would increase each year as the budget increased. The same thing would happen to our permanent improvement fund. This year, we're taking $684,000 out of the permanent improvement fund because we had a very small surplus last year. We weren't really adding a lot to that budget item. Our actual permanent improvement fund expenditures average about $1,339,000 each year. We have about $580,000 in dedicated funding from fee and lieu and fire tax, but we have to make up about $758,000 on an annual basis for the permanent improvement fund. If we continue to just delete it from permanent improvement fund, that fund will be completely deleted before you get to 2020. So within 5 years, you'd be at the minimum fund balance, and your permanent improvement fund would be completely deleted.
Michael, can you explain with the fund balance? I understand what drives the reduction from 15 to 16. What are the factors there in having it continue to decrease from 16, 17, and on? What are the assumptions?
Well,
behind
because
that?
of the hole, the $1.1 million hole, and closing that with fund balance, there's going to be a bigger deficit next year.
Right.
We lose the permanent improvement fund offset and the opening balance, so you have that $800,000. But in addition, as our costs go up, you can see this year, last year we had, I think it was $521,000 deficit. This year it jumped to $1.1 million. It's not unreasonable to think that's going to be much higher.
So this model assumes that we'd have to continue to go back to that to bring the budget into balance.
And limiting it to the $1.1 million.
Right.
That's assuming you're going to have a tax increase and just take $1.1 million
Got it.
each of those years. Quite honestly, I don't know if that will occur, if the board has the necessary restraint to implement a tax increase and to continue to take it fund balance. It's equally likely they would want to deplete the fund balance at a quicker rate. Instead of that gradual decline over 5 years, that could be depleted in 3 years, depending on how much we take out of it. So In either scenario, it's certainly not positive. Just to quantify, another option to close the funding gap of $1.1 million, because we expect this to come up tonight as well, is what would it take in terms of reduction in staff to offset that deficit? We're not recommending these reductions. We just want to quantify to give you some idea how many people, how many positions you have to eliminate to close that gap. For the police department, we represent 3 officers and 1 non-uniform personnel. The administration, finance, and engineering, we're looking at 2 full-time positions and 1 part-time position. Code, there's 1 full-time position. Public Works, 2 full-time positions. Library, 2 full-time positions. And Parks, 2 full-time positions. We have to add some money back in the budget. We project about $50,000 to offset additional unemployment costs associated with those reductions. Of those reductions, a portion are attributable to expected employee turnover. There is some current vacancies. There are some projected retirements. That represents about $488,000 of the $1,166,000.
What was that number again?
$488,000 through employee turnover. The problem with just, someone might suggest, well, why don't we just, put a freeze on hiring, don't fill those vacancies, and take advantage of the savings of $488,000. The problem with that, it only impacts two departments, really. So basically, 2 departments we're shouldering the whole burden there, and whether they would actually be able to efficiently operate as a result of those reductions is open to question. There would be some impact on services, certainly. On personnel, if the board has specific questions, because each of these numbers are tied to actual positions and actual benefits attributable to those positions, obviously, we don't want to, we prefer not to discuss that in public. If the board wants to pursue it and discuss it in greater detail, maybe at the conclusion of this meeting, we could adjourn to executive session and discuss it in executive session, if you so desire.
Michael, why do you say only 2 departments are affected by the reduction in staff?
The main impact would be on police department and library.
He's talking reduction in not filling retired positions.
What was the second one?
Library and police departments. The other ones would involve layoffs. The other reductions would involve actual layoffs.
So the attrition cutbacks would be in the police and library, okay.
Yes.
And that would be 488,000.
That's correct.
Shouldered, hypothetically.
Hypothetically, if we imposed a freeze on hiring, we could eliminate about 488,000.
And anything beyond that is pink slips.
That's correct.
Michael?
Well,
Mr. Chairman, may I ask a question? Under police, the 3 police officers that you have accounted for here, if this was the direction, are these salaried employees? Are these new officers? What rate, where did you get the 312 for 3 officers?
currently in the police department, we have 2 vacancies for uniform officers. We have 3 retirements projected for next year. But with those retirements, each of the officers or the employees has accrued time. So before you can fill those vacancies, we have to pay off their existing time. So say an employee will retire in May, they may have a certain amount of time in the banks. You couldn't take advantage of that until later in the year. Those 3 retirements combined, the net result is basically 1 additional employee. So the 2 vacancies we currently have, the 3 additional retirements would net out as 1 employee savings over the course of the year. The other position would be a non-uniform position, a support staff position.
But those 3 positions that you said, the 3 retired positions, that would equal roughly 1 full-time staff next year.
2016. In
Right.
17,
2017, you would actually
Exactly.
tripled.
Exactly.
Michael, just to make sure I understand, again, again, hypothetically, going the attrition route, that would, from the police department, that would cover the police, 3 police officers and the 1 support staff, or would the 1 support staff represent a pink slip?
The 1 support staff would represent a pink slip. I should clarify one point. The code enforcement position, we are projecting 1 retirement. We haven't received the paperwork yet. That's assuming that person retires, and we contract out that service to a third-party inspector. Would result in a net savings of about $70,000. But there wouldn't be necessarily a reduction in service, because we would still provide the same service to a third-party vendor.
Question, Michael. The page where you have closing the fund balance with a tax increase, my question is, the numbers that you have there, the .329 millage increase, the 8.23% increase, and so on and so forth, does that assume no changes in reductions in staff and no changes in extracting anything from the fund balance?
That's correct.
That's strictly a tax increase and no other support mechanisms in place, correct?
That is correct. That's maintaining existing level of employees, existing level of services, and not taking any from fund balance to close the funding imbalance.
So if you go and look at all 3 of those entities instead of just the tax increase, you could reduce that specific number if you go and look at all 3 of, in other words, the fund balance, the staffing, and the millage increase as a possibility of closing the balance.
That's correct. But each one of those steps would have some implications, not only in the budget, but also on the level of services.
Michael, the current fund balance, you're saying, is 9.261?
Yes. We're at the maximum level currently at $9.2 million.
And that's
correct.
25% of our budget.
That's correct.
It's a pretty high fund balance.
Well, remember, I mean, it's a fund balance policy that we all voted on last year.
Well, we voted on how to handle excess in the fund balance. I just think 25% of your budget, I think we recalled hearing from our Sue and maybe Kevin, that to maintain a high rating with the bonding agencies, you only needed roughly 10%, I think, or so of your budget put aside. So obviously, we're well in excess, aren't we? What is that?
I don't necessarily agree. I think, the stronger your fund balance are, I think the bigger implication on your rating, if we were just continue to delete that fund balance to the minimum level and we showed a trending going down, it would have an impact on our rating, I suspect.
Well, I'm not saying down to the minimum level, but I'm saying they don't tell you have to have 25% put aside, do they?
No. The 25% was basically through the GFLA. Their guidelines was a 1 to 3 month recommendation as a range for fund balance.
And what do the rating agencies suggest?
I know it's always been positive in prior bond issues. They've always pointed to our healthy fund balance, supporting our high rating, what level we could reduce it, and what the corresponding impact on the rating. It'd be difficult to quantify here.
I'm just saying, do they suggest a level?
Not a specific level, 25% or 20%, no.
All right, thank you.
But if you reduce, remember, if you reduce take it from fund balance, any excess money this year would have to go to replenish that first before it could be applied to permanent improvement fund or opening balance in 2017. So you're creating not only the deficit from the offset, but also the loss of the permanent improvement fund funding as well as the opening balance. So it does have a dramatic impact on 17, much more than probably $49 will this year.
Commissioner Schreiber has a question. Have you finished, Commissioner Bell?
Yes, thanks.
Thank you.
So if we were to go strictly with tax increase, $49, in 2017, are we going to be back here and it's going to need to go up another $49, or is this going to take care of the issue? Sure. Yeah, what I was asking is, will the $49, if we do that for this upcoming 2016, will that take care of the issues that we would have, or in 2017, are we going to have another $49 or more?
Yeah. It's a very valid question. we'll be in a stronger position than we are in today going into 2017. I certainly can't represent now that that'll offset any obligation because the costs continue to increase. I mean, we had a very good year this year for health benefit increases, with the exception of prescription. I mean, the 5%, averaging at 2.5% between all employee groups is tremendous. It's the lowest it's ever been in probably 20 years. I can't guarantee we're going to have a much higher increase next year. I mean, our total health benefit costs are a huge number. I mean, a 10% increase would be, $750,000. So faced with that kind of increase and raises, we could potentially face another tax increase next year. It's certainly a real possibility. It's certainly, we won't be flush for going forward. We'll be in a stronger position, but I can't guarantee we won't require a tax increase next year.
And are we looking at other prescription alternatives?
Well, we're looking at insured products. We are moving to a different plan administrator. We're recommending that. We're looking to contract directly with a pharmacy benefit manager. But in the long term, I think we need to introduce a third-tier contribution by employees so they have more skin in the game when it comes to these specialty drugs. And this is a relatively recent occurrence. I mean, you have the Hep C drugs, $100,000 a year. We have someone taking, and we have no idea what employees are taking which drugs under HIPAA regulations. We just know what drugs are being used. We don't know if it's an employee, a dependent, a spouse. We're not privy to that information, nor do we want to be. We just see the drugs being used and the costs associated with those drugs. But we have somebody under the police group that's taking a drug it's costing $90,000 a year. With with the $20 copay on a $90,000 prescription, there's really no incentive to look at other alternatives. The employees need to get involved in this decision and cost sharing and a better management of their health benefits.
But there are other prescription drug companies that you know of that do that three-tier?
I think that's the trend. Everyone's moving in that direction, no doubt about it. You have to. You have to.
Thank you.
Commissioner Gillespie.
Sure. You mentioned on code that maybe if this person retires, you could get an outside company to just, does that actually save the township money, or?
It has in the past. We've done that with our plumbing inspection. We've done that with our plan review. And it does. The third-party inspector will take a percentage of the permits, so we lose a little money there. But so we're not paying an employee, we're not paying benefit costs. And benefit costs are the driving factor here. Pension obligations, Social Security, so there is considerable savings there. And we do, looking at real numbers, it's about $70,000 savings.
Okay. Thank you.
Commissioner Hecker.
Yeah, I just wanted to make a point that, the earlier workshop where we reviewed capital, there's a list of priority projects in the township that is, it's exceptionally long, and we couldn't fund them all if we depleted the entirety of our current fund balance. And these projects represent real needs for people that we represent. And I'd be worried about an approach that moves us away from a path of continually replenishing the permanent improvement fund. It's not enough as it is. And to further diminish that, I just don't know what I'm going to say to the people that I represent who have real needs, and we don't have a viable means to address them.
I agree. And our next slide is addressing the permanent improvement fund. If you don't mind, I'll move right into that. When we had our capital budget meeting, we projected $333,000 in capital expenditures next year. But we didn't address a number of factors. Approximately $1.5 million in economic development projects, basically the percentage match for different grants, the Noble Center grant, Crestmont Station grant, as well as the pending grant for Old York and Susquehanna. Our 30% contribution to those grants equals $1.5 million. We don't have a funding source for that. The engineer's office also recommends about $775,000 in stormwater projects, 10 projects for next year. So we pursued, some of the commissioners raised the possibility of a bond issue next year and what would be the implication on the budget. So we did research that with bond counsel and our consultant. And we looked at a $3 million bond issue. We didn't have these numbers at the time in terms of the stormwater projects. But for a $3 million issue and backloading it, wrapping it around existing debt, so we're just paying interest the first couple of years and the principal factoring in later years, the additional cost for 2016 would be approximately $36,000 on a $3 million issue. Now, if we did a $2.27 million issue, the cost of insurance are almost identical. That doesn't go down. Your bond counsel costs, your printing costs, everything else associated with it doesn't go down. So that's about approximately $90,000 a year. But to save the interest cost would be slightly less. So we could, if the board wanted to, sometime next year, introduce a bond issue. We don't have to do it now, because we don't know the status of the Old York Road Susquehanna project. There hasn't been a firm commitment on the Noble project, so we don't want to borrow money and then find out we don't need $1.1 million of it, because you have to spend that money within a certain period of time. But if in the first quarter of next year, those projects fall into place, we're awarded the grants, and we'll take advantage of a significant amount of free money, we can introduce a bond issue and cover the cost of interest, probably through our contingency account, without any dramatic increase in the budget. In 2017, the interest would be slightly higher. There'd be a small impact on principal as well, but nothing that wouldn't be unmanageable. The major costs are down the road. We're basically extending our debt service 2 years to 2022. Right now, on our current debt service schedule, most of our debt service is paid off in 2020.
And when you say wraparound, so we can structure the bond issue so that we don't end up with a larger payment somewhere along the line. We'll be able to push that after some of the other bonds mature.
As the other bonds mature, the principal of the new bond would just roll right in. So you maintain existing budget level for debt service and just extending it a little bit further out, cover
So we can adjust the
entire principal.
wraparound schedule so that we don't have a big number 1 year, because we're trying to hit the beginning of this principal payment and the end of other principal payments.
Exactly. As opposed to a 10-year or 15-year level payment schedule, where it would have an immediate impact on the budget.
Right.
And again, our debt service is very, very reasonable. It's a small amount of money. It's very manageable. We're well within the limits and borrowing base. We have no problems there. And worst case scenario, you're looking at 2022 to be debt free. Because there are other projects that we are facing down the road. We're looking at our pools. There's obligations at some of our facilities, like Avathorpe Manor, that we're going to have to address going forward. So our additional capital needs we're going to need in the future years.
I know in the past when we've bonded, we've bonded primarily for stormwater management projects, and there's been some stipulations on those bond issues that we had to use the money for stormwater within a 2-year. Does that affect the bonding, because we're going to actually only only $800,000 is going to be used for stormwater, and the other is going to be used for other type projects?
No, I don't believe so. I mean, the rating agency is based on Abington Township, not necessarily the purpose of the funding. So that won't be an issue. So I just, we're going to throw that there. We don't want anyone to think we forgot about those issues. Suggest we finalize the budget and some of unaddressed issues that we'd have to face in the first quarter next year.
Commissioner Spiegelman.
Thank you, President Luker. Jumping off of what Commissioner Hacker said, these permanent improvement fund projects represent a combination of vital infrastructure improvements, as far as stormwater, as far as safety concerns, that are absolutely needed, and also very significant economic development investments, the whole idea of which is to get our significantly underperforming commercial corridors up and running so that we are not faced with this every single year, so that, because we only have but one mall. The mall generates, a certain amount of income. We have a mall, we have a Betawood shopping center, et cetera, but we need these investments. I think bonding is not only a good idea. I think it's sort of the only way to go. I think it's a very worthwhile investment. And I just sort of wanted to. I keep reminding myself of this, and we're going over these hard numbers, and these are very hard numbers. We're in an unenviable position. The idea of any tax increase, let alone a $49, $50 tax increase, is downright nauseating. But it's also an important reminder that we're talking about something of a doomsday scenario, one that, as I've mentioned to some folks, reminds me of the plans that SEPTA puts forth every time that they're faced, every couple of years when they're faced with significant underfunding, they put out a map of their service cuts, and everyone sees how radical those will be. And when I look at those, those lists of employees lost, as we all know, the overwhelming majority of those folks they're not just sort of abstract employees. They're our constituents, they're our neighbors and our friends parents. Because that's the whole thing about Abington. I mean, everybody's all related. It's all a big family here. And along the same lines, when we talk about those prescription costs, which are have gone up, I use the word despicably. You say if there's a drug that's not, $20 on a $20 copay on a $90,000 drug. I mean, that very well may represent something that's keeping the child of one of our neighbors who happens to work for wherever, the police department or public works or whatever, alive. And it's something we have to. I always try to force myself to remember that it's some way beyond numbers here.
What'd you say?
I have not spoken for a long time, in a long time. Grant me one.
I know, I just lost you. I have a question.
Yes, Commissioner Myers, and then
Okay.
Commissioner Sanchez, you have a question?
I'm
Okay,
sorry.
after
No, I didn't.
Commissioner Myers, and then Sanchez.
Michael, I want to go back a little bit to the beginning. You're suggesting a $49 average household tax increase.
We are, and we don't take this lightly. We haven't raised taxes the last 2 years. So in some sense, we're a victim of our own success. You may recall at the October meeting, we showed a chart illustrating the consumer price index since the last county reassessment versus the tax increases in Abington. And we were less than half the rate of inflation, our tax increases. The board's done an excellent job historically, going back 17 years, in controlling the rate of tax increases. But unfortunately, our revenues aren't keeping pace with our expenses. Our real estate taxes are at best level. There's no growth there because we're almost fully developed. And any increase we have through redevelopment are offset by tax assessment appeals. So a third of our revenue stream is stagnant. We get some relief from business taxes and building permits in some other areas, but there's not enough to keep pace with current expenditures. So we're in a difficult position. We certainly don't take lightly the suggestion of a $49 tax increase because there are residents in this community that are on fixed income, and $49, $50 is a big deal, and we're sensitive to that. We don't want to minimize it in any way, suggest it's $1 a week, it's no big deal. It is a big deal. And unfortunately, we had to deal with the reality. It's really a question of what level of services we want to provide, what the residents expect, and what they're willing to pay for. I have the impression the majority of people are willing to pay a little bit more to maintain existing levels of services. That's the assumption we're operating under. We don't get a lot of feedback through the budget process from residents, very, very little, if anything. It's only after the fact, in those years when there is an increase, we do get some input back with a handful, and it's basically a handful of people who express dissatisfaction. 56,000 people, and it's only a handful of people that are upset. So to some extent, people understand the cost of operations and costs do go up, but it's still, it's a difficult balancing act, and we appreciate the predicament the board's in approving a tax increase.
And here's my question. First of all, I understand everything that you said, but a $49 increase is huge to a significant portion of our township. And once again, looking for the compromise, could we take half of that in terms of an increase and then make up the rest out of fund balance? And would that keep us in the 10% that we have under our policy that we are allowed to take out? Would that half be within 10%?
Well, you could take anything from the fund balance of policy.
But
Yeah, I understand. You would be within the policy. The policy defines a minimum and a maximum. It doesn't, in between, you can go anywhere in between you feel comfortable with. It does have implications on next year's budget, though, because any surplus this year would have to go to fill that gap, to bring it back up to the maximum level. Because if you don't do that, that just continues to deteriorate, and eventually you're at the minimum level, and then you're stuck. So any surplus first goes to offset, whatever you take out this year goes to offset that, then you're working off a smaller number, going to permanent improvement fund, opening balance, and OPEB obligation. So, and that will have some implications on next year's budget. If, we're spending $1.3 to $1.4 million in capital improvements, and we only have dedicated funding of $580,000 and don't have any additional going in there, we have to come up with that money, or just don't buy equipment or implement these improvements. So it will have an impact. It puts us in a tougher position. Anything you take out of the fund balance policy puts you in a difficult position the following year. Less, it's certainly more palatable than $1.1 million if you take half out, but it still has an impact.
Well, I understand that, and I'm going to say exactly what I said last year. We hear that every year.
Mm-hmm.
But, and I certainly am not going to speak for anybody else, but a $49 tax increase will not fly in Ward 8.
Mm-hmm. And you may recall last year, I did say, hey, we're running out of tricks. And if you look back the last couple of years, we took our overlay program, we took it out of the general fund budget, we moved it over to the permanent improvement fund to remove that obligation from our general fund. We took out our contribution, a $500,000 contribution to the permanent improvement fund. We took that out through the new fund balance policy because we thought that would be offset by revenue coming in. So we moved items off. Those expenses didn't go away. They're still there, but we've done everything we can do to play with the numbers to minimize the need for a tax increase. But we're really running out of options at this point.
Michael, taxes have been steady in 13, 14, and 15, correct?
That's correct. Well, 13, there was a very small increase in 13. 14 and 15, they remain the same.
Any other question? What would taking $500,000 from the fund balance do to that number that Commissioner Myers is referencing, hypothetically?
Well, that $500,000 would have to be offset next year
Right.
with any surplus. Plus, the fund balance limit would be a higher number. I believe it's a couple $100,000. So that also would have to be addressed.
Right.
So, the first, say, $700,000, and I'm just approximating, would have to go to the replenishing fund balance. So you're working with a much smaller number, which has an impact on 17. You have less money going to your permanent improvement fund, less money as an opening balance. So your costs are going to go up, and you have these additional expenses also factored into it. You'll be in a tougher position next year. So, and it's, is that more palatable to residents, an increase this year and an additional increase next year of the same level, a little more, it's a judgment call. It's hard to say.
It kind of goes back to Commissioner Schreiber's question.
Exactly.
Is the 49 going to tie us for 2 years? And the question is, you don't know.
Exactly right.
But if
Well, but we don't know about that, but if we take money out of fund balance, we know sooner or later that's going to catch up with us. I mean, it may be, and I understand Commissioner Meyer's suggestion, but if it's $500,000 now, it's going to be, $750,000 next year, and that number is just going to keep growing, which, goes to the same question that Commissioner Schreiber talked about is, at some point you're going to catch up. I think one of the things we do need to seriously consider is what the suggested cuts, or this list of cuts, how they actually affect services, so that the board has a better understanding as to whether we can live without them, because we keep talking about tax increase, we keep talking about taking money out of fund balance, but we're not addressing the actual operating expenditures. And I think, and I'm not suggesting we necessarily cut something, but I think we need to figure out exactly what what the effects of some of those cuts are, because, if we maintain staffing levels and the service levels, I mean, they're going to go up. We all know that the expenditures are going to go up. We've all seen the contract negotiations with whomever, and the cost of just having employees goes up every year. So I think that's something that we have to, I think there has to be some conversation about what the effects of those cuts would be, and whether they're palatable service cuts, or if they're even service cuts at all.
And at some point, we certainly should have that discussion, and probably in depth. It's more suitable for an executive session, and if you wanted, we could also have the department heads impacted by those cuts to provide their input at the same time. We can have some of that, part of that conversation tonight, or we could schedule a separate meeting. Going forward, though, we next Thursday, we had a tentative meeting scheduled. I assumed, we were going to need that meeting for a first reading of a budget, so I did advertise for a public meeting for next Thursday night. But at that point, I mean, next Thursday, we're real tight in terms of the deadline with advertising requirements for our budget. If you want to adopt a budget in December 17th, you can push it out later in December, give you a little bit more time, but we need to come to some conclusion by next Thursday. So we can schedule an executive session. We can do it tonight. We can do a separate night if you want to address personnel. And during the open session, answer any other questions you may have related to the budget.
And I think it's important. I think it's important also to mention, we're not actually looking at a 1.1 deficit. We're actually looking at close to a $1.8 million deficit. We've offset it because we put away that money into the permanent improvement fund last year from the fund balance policy, and we've pushed off the capital, the permanent improvement expenditures in the budget to feed off of that permanent improvement allocation that we took from the budget. So we're actually looking at a $1.8 million deficit. It's only because we have that permanent improvement fund. Is that what I understand?
That's exactly right. And it's actually a little higher if you factor in overlay, taking overlay out and also putting that in a permanent improvement fund. So it would be much, if we hadn't taken those steps, the deficit would have been over $2 million. Absolutely.
So if we had run out of that permanent improvement fund, hypothetically this year, we'd have to now find $700,000 back into the budget.
Exactly right.
Or take that out of the actual bulk fund balance.
Exactly right. I mean, the new fund balance policy, and in some sense it ties our hands, but it does provide a dedicated funding stream for a permanent improvement fund as far as our OPEB obligations. I mean, our OPEB obligation, don't forget, it's a $36 million unfunded liability that we're trying to address. So, and it also provides some budget relief for the opening, for the budget the following year. So it does a lot of positive things and maintains a healthy operating balance, a surplus. But it does tie our hands to a certain extent. We don't have the flexibility that we had in prior years that we just turn the fund balance anytime there was an unexpected expense or a capital need that arises.
Commissioner Zapone.
I got to kind of follow up with what Commissioner Myers said. $50 to a senior citizen is a drug that they need to survive. $50 to a senior citizen is food for their table. They need to survive. $50 to a senior citizen, I've spoken to many, it's a lot of money. So did we tighten our belts? Did we sharpen our pencils? Did we explore every avenue possible to get this down or to possibly eliminate it?
I understand what you're saying, Commissioner. 76% of our budget is directly tied to personnel. So the remaining 24%, we've been beating to death the 5 years I've been here and for 10 years before that. There's really nothing left to cut in the remaining 24%. And a lot of the 24% are fixed costs that you have no control over. It's your electricity, it's your gasoline, it's your insurance. So there's a really small percentage in there that you actually have any flexibility at all. And those numbers have been level for over 10 years. We're working with the same numbers that we were 10 years ago in those categories. So that's why we showed you the illustration to close the gap through personnel. And nobody's recommending cutting personnel. I mean, it's a dramatic step. But that's really your only other recourse. If you want to stay within your means, in your revenue means, you have to cut costs, which means cutting personnel. And it's certainly not something we recommend, but it's the only other option you have. And it's unpalatable for a senior citizen, a $49 tax increase this year would be. Can you imagine the impact if next year we go back to them and say it's $149 because we just took it out of fund balance this year and we're in a much more difficult position next year? It'd even be more dramatic. It's certainly not going to be less. It would be more dramatic next year.
Mr. Sanchez.
Michael, I'm not trying to make the picture any more bleak here. This is a minor thing, but on the expense revision sheet, for something like the civil service exam, since we know that's a recurring expense, wouldn't that be sensible just to add back? I mean, I know you fund it from a contingency, but why not get it in?
Well, that was our position we added back in the budget. It's recurring expense. It almost occurs. It doesn't occur every year, but it almost occurs every year depending on where our needs are. But anticipating the possibility the board might opt to a freeze on hiring, we thought it makes sense to go back to taking it from contingency. So that's why. And believe me, we looked at every line item to cut wherever we're possible.
So that's not it. Then or you answered it. That's not contractually obligated.
No, absolutely not. No. And for a long time, that was taken from contingency, and it worked out well. It wasn't a problem.
And another, this may go in the other direction, but you and I discussed briefly, but is there any relief from any of the new projects, like some of the building permits we can expect in the Penn State project?
There's some revenue expected with the Penn State project. That'll be over several years, so that's not directly factored in. We had a great year this year in code enforcement in terms of building permits. It was much higher than we had budgeted. We certainly didn't want to just throw that number in there next year and depend on that, rather take advantage of that. And year end is a little bit of a surplus and overestimate our expenditures. The last thing we want to do is finish the year in a deficit position, so that would have a dramatic impact on the following year budget. But there are some numbers out there, that you had mentioned before, Penn State being one of them, that aren't necessarily built into the budget at the present time.
Commissioner Hecker and then Commissioner Bowman.
I would just like to recommend that we begin the conversation tonight in executive session following our conclusion here. We've got a lot of work to do, and I think we have a lot of options that need to be explored in depth before we can reasonably feel comfortable about any direction here. So that would be my recommendation.
Commissioner Bowman.
Just that I would agree with Commissioner Klein's earlier point that all three areas need to be probably incorporated into addressing this deficit. It's 2 years in a row where we've come up with, $1 million deficit. And at that point, I think some belt tightening probably is appropriate.
Any other questions on this side? On this side? Any questions from staff? Any questions from the audience? Name and address and 3-minute speaking limit, please. Thank you.
Laura Lehman, 1431 Bryant Lane. I don't think I've seen so many smoke and mirrors in any show in a long time. So, and I've seen this in past shows. I am just appalled at how this just keeps going in this direction. I have the fund balance analysis here. So, in 2004, we went from 10 million to 11 million to 12 million the next year, then back to 10 and 11 million. This is excess money with absolutely no requirement, no plan to fill a gap or anything, and we kept all that money. That was money that was overtaxed to residents, not returned to them, okay? And plenty of projects in this township are funded that have nothing to do with real township management, with real township, that most of the residents and those people that are on tight budgets would not approve. I don't approve almost all of them, and I'm going to mention some of them to you. Okay, it is, and I want to mention real quick first, Social Security, I think, got a 0 increase. So all of our seniors and people living on Social Security, okay, while we're spending money at this rate, are getting almost nothing back again. The discussion of the contributions to nonprofits that we've touched on here, but nobody ever, I mean, I want to see a budget come where everything that's not essential is put off in a place, and if we have any money left over, we'll fund it, okay? But we just had the VNA, for instance, come here, and our lawyer and our land were considered for donations. No questions asked. Cameras all over. We want to fund that. Jackson Park. We want to do things with trees and stuff. We have other trees dying and can't fund them. We have so many things. We have special bonuses and hardscapes being done for businesses who have the same obligation all the rest of us have to do our lands, our hardscapes. When they get a bonus and you pay for their hardscape, I am paying for their hardscape. And I have enough trouble paying for my own. Come fix the cracks in my driveway. So we have donating the bus shelters to the hospital when they came. They said, if you need to be made whole, we'll make you whole. You said, no, we don't need it. Senior citizens here can pay that. Okay, not a problem. Each cut could affect the essential services you're saying. Those aren't essential services you're funding. When you start to actually ask your finance director to take everything out of the budget that's not an essential service, you will find that you have plenty of money to fund the essential services at the level that the taxpayers would like. And then you can ask them if they would like to fund star communities and all the other things that are being funded. Okay? And I know that supposedly came out of the EAC budget, but that was the EAC is funded by the township to a great degree, who does a lot of their work for them. And then they sold the rain barrels, and everybody was told they had to get rain barrels. I had a neighbor who was told that she couldn't improve without getting a rain barrel, or she'd have to do other major improvements. Those kinds of things are nuts. Okay? That's the smoke and mirrors going on here. The real story is take everything non-essential. The police budget, we're told that the police don't have the funds to investigate all the burglaries. They don't have the funds to investigate all the crimes. That was said at the crime meeting. They have to pick and choose which ones. Well, I'd like them to pick and choose not to do Police Academy, Police Night Out, PAL, Explorer League, and all of those things. I'd like them first to investigate the crimes. And then if they have some money left over or they have other ways to get funds, then by all means add that. But I don't think we have any idea how many hours are going into all of that. And while it's generally supposed to be overtime hours, those are not always how they shake out. I think we all know that. Okay, and in essence, one of the other things that I'm constantly...
You've exceeded, you're going past 3 minutes. Are you close to finishing?
I hope you might let me go a little
ahead.
past 3 minutes.
I'm going to give you
because
some more time, but I just
appreciate
want you to
that.
wrap it up.
One of the things that I am constantly reminded of by residents in the township is that we have so many, and we applaud our police officers and the level and the caliber that they are. We want our management teams to be like that. But we seem to be getting a police force that almost has master's degrees to patrol a community. And so when you have somebody with a master's degrees and all kinds of qualifications and they're sitting in a car watching traffic go by, that is a concern. And those are the kinds of comments that I'm getting from citizens, and I agree with them. So the 17 years no tax increase, I think we already determined that was bogus. What happened is services were being removed, and I could list them for you. So we didn't have any 17 years. In fact, the whole time that I've been here, my taxes have gone up and up and up. And that's my concern with the economic development. So I don't want to pay for Noble Plaza. I don't care if they get a grant or what they do. The developer is going to be enriched. My traffic is going to get thicker, okay? And the
Mrs.
end...
Lehman, I think you're going on and on. We'll be
Okay.
here for
Then
another 5
the
minutes.
end analysis of that, though, is
Thank
that
you.
the residents of this township are paying for that developer to develop his own property. And those are the things that we don't want to do. They cost dearly, and they are not essential services.
Okay.
So somehow we need to understand that.
All right, thank you for your comments, Ms. Lehman.
Thank you.
Can I,
Any other comments from, hold on, sir.
Yep.
Any other comments from residents? Going back to commissioners, any comments?
yeah, so I had to write them down because the litany of things that just were spoke about that were just completely taken out of context and are untrue.
Mr. Lehman, no, sit down,
He's going to
please.
say that. At least let me come up afterwards. When
No,
he
Mrs.
leaves
Lehman.
this community with false
No, Mrs. Lehman.
impressions afterwards.
Mrs. Lehman, you're out of order. Please
Will
sit
you
down.
please let me correct if
Please
he's
sit
made a
down.
mistake?
Please sit down.
Thank
Thank
you.
you.
So unfortunately, we don't get to just put out untruths and without them being responded to. And put them on camera and expect people to believe that the person that was speaking is speaking for all the community. So let's go down the list here. Cameras that she's speaking about, I assume she's talking about the cameras that we spoke about last month. Just as a discussion item, none of those are funded, and the conversations were going to continue, and we haven't even come to some conclusion. Jackson Park has been a property that was owned by the township, hasn't been touched since we bought it with the county open space money, and we pick and choose parks, whether it's Roslyn Park or, I mean, we all have parks in our ward, and everybody gets a chance to use the money, use capital money to fix them up, and Jackson Park is getting fixed up. She's talking about dead trees here, dead trees there. I mean, we do have to pick and choose. We can't hit every park in the township. Sidewalks and business districts, we've talked about this. I mean, if anything, we have to keep our commercial districts vital, because if we can't attract businesses and we can't keep businesses in, then we have more money that we have to put on the burden of our residents. And I'm all for spending money in our commercial districts to make sure that they look right and attract businesses and attract people to there. I wish we could do more, but we can't. Donate bus shelters. I have absolutely no idea what she's talking about that. The hospital came to us with a proposal. They were going to look for grant funding to see if they could take over the operation of the bus shelters. We still haven't heard back from them. That's still in flux. Nothing's been decided. Star communities. Star communities is something that's costing the township nothing. The EAC went out and got grant money, and they used that grant money to send 2 of their EAC members down to Washington, D.C. to get training, and that's all the expenditures we've had so far, correct?
That is correct.
Okay. Burglaries, and the police can investigate crime. I mean, I've had some back and forth conversations with the police department, and I got to tell you, I've never heard the police department ever talk about that they don't have enough manpower to investigate crimes.
Mrs. Lehman, please.
And to suggest that is ludicrous and gives. Excuse me, I'm speaking. You had your time.
Please.
You had your time to lie, and you're not lying anymore.
Commissioner Klein.
Okay. Tuition reimbursement. I'd have to ask questions about that. I mean, I know we have some tuition reimbursements. I don't know what the requirements are for those. And then 17 years without a tax increase. I'm not sure anybody on this board has ever uttered those terms, especially when we all know that we've had tax increases here and there over the last few years. We've had fire tax increases. We've had property tax increases. Whatever. I mean, 17 years. I don't know where she gets the numbers, but I assume that the years that she's talking about is just to inflate the point that she's trying to make, like she has made on everything else. And I think I covered everything. If anybody else
Mrs. Lehman,
cover more of the
please.
issues, I would be
Personal
open to that.
defamation.
Please,
You can't
Mrs.
allow
Lehman.
that without a response. Be
Mrs.
polite,
Lehman.
please, and
No.
allow a response, because
No,
what
thank
he's
you.
saying
You've already spoken.
amounts to defamation. That's
No.
ridiculous.
You can pick this up with your commissioner after the meeting.
Okay,
Please.
these things are on film, and
Mrs.
the
Lehman.
19 years of tax
Mrs.
increases
Lehman,
is a
please. Have a
newspaper
seat.
headline.
Now it's
Thank you.
19 years?
Commissioner Klein, please. And Mrs. Lehman, please sit down.
Someone here said
Commissioner Klein,
separate.
no more comments. Thank you.
Disgrace.
Are there any more comments from commissioners? Commissioner Myers and then Spiegelman.
I think I can clear up the 18 years of no tax increase. What happened, and I wasn't around for all of those years, but the years that I was here for with no tax increase, we never truly balanced the budget. The practice was to take the money out of fund balance. The Speaker said that we kept that money and didn't return it to the taxpayers. We certainly did. We did it by not increasing taxes for 18 years. The money was taken out of fund balance. Last year, a fund balance policy was put in place because there were things in the future that we need to start putting money away for to fund all of the post-retirement benefits. Manager Lefevre brought that to us. I'd like to say a couple of things that were brought up by the Speaker are safety issues. Cameras, which we're considering. We haven't certainly made a decision. But you know what? Safety costs money. And we have to make these decisions. It's a very fine balance, but our residents expect to be safe, to feel safe, and to go to places and have that safety factor. And those are the decisions that we have been elected to make for the residents. I know, of course, the most closest to home, the Abington Police Athletic League. Although it is sponsored by the police department, it is 100% a nonprofit organization that pays all of its own expenses, and that includes if there's any police overtime that is paid for by PAL. All PAL's money is privately funded and raised, and you all help with that, with all of the events that you go to for PAL and things that you contribute, but 100% PAL pays for itself.
Thank you. Commissioner Spiegelman.
I just want to clarify just one small point for anybody watching. There is not going to be any land donated to the VNA. There's not going to be a VNA parking lot on Highland Avenue. That's none of that is going to happen, so I don't want anyone to be under a misconception. So, there. Thank you.
I appreciate the clarification of comments made by the public by Commissioners Klein, Myers, and Spiegelman. Are there any other comments from commissioners? Okay. Any closing statements, Township Manager LaFever?
No, Commissioner.
All right, Finance Director, any comments? No. Okay, if there are no further comments, I'll entertain a motion to adjourn.
Adjourn and go into executive session.
At this point, we'll close the hearing, and the commissioners will proceed to executive session. Thank you.
I do have one comment. It has nothing to do with the budget. I just wanted to wish the Marine Corps a happy 240th birthday.
Thank you. Meeting's adjourned.
Well, then, we're going to wish Commissioner Steve Callahan